And so we just completed our briefing on mental health and boys and men. And so we have Dr. Wizdom Powell here from the University of Connecticut. And Dr. Powell, can you tell us a little bit about what you do, what your role is at the university?
Sure. Currently, I'm the director of the Health Disparities Institute at UConn Health, and I'm also associate professor in the Department of Psychiatry. And my work focuses primarily on trying to advance health equity for boys and men of color in the United States.
Great. So we have some notes here. You talked about the economic cost to male health disparities. Can you spend a little bit more time talking about how this message can be relayed to policymakers in Congress?
Yeah, I think it's always important to put these issues in an economic context. Even though I move through this work, from a heart space, I recognize that to really get the attention that we need, it's important to point out the economic bottom line. And so we know that mental health disparities have a significant impact on our capacity to compete in the global marketplace because it directly depletes human capital. It has an impact on worker productivity, and it also affects male participation in the labor force. And I think that's something for us all to be concerned about.
And do you feel that more needs to be done within policy to affect health care? And we know that access to care is a huge issue for men and women, but men specifically, how can we do more to address that?
Yeah, I think healthcare is one policy opportunity that we have to directly minimize the barriers to treatment access. For sure, we know that men are least likely to be insured, even despite socioeconomic equality. At every income level, we see that, right? So it's not necessarily just that men can't afford to get insurance. Some are resisting insurance for other unknown reasons, likely high mistrust, likely fear of being vulnerable, and all the kinds of reasons that we've been talking about in today's briefing. But I think that we have to also leverage opportunities to reach outside of the healthcare system and to connect clinical practice to community, based organizations. And the clinical community integration effort that's being advanced through many of the state innovation models are a prime example of how we might do that. So we need access to care points at places where men live, work, play, and pray. I've been doing my work in barbershops, for example, like many other folks who work on men's health around the country, because we know that we have to bring the care to the people and not necessarily expect that people are going to come to us. And this is even more critical for mental health issues, where there's stigma and other kinds of issues that might push back on men's decisions to get help.
Right, because like you said, when boys are growing up, we're telling them, to suck it up, be a man, be the man of the house. And so, if you get hurt in the field, coach says, run an extra lap, just run it off. And so we're not teaching them how to actually express themselves and how to actually be vulnerable in situations, but still recognize that it's still being a man, it's still manly. So how does law enforcement policing fit into thinking about mental health issues, especially in men of color?
Well, sadly, we all have been bearing witness to the uptick in racial profiling and the uptick in police-related homicides among brown and black men and boys. And, if we are going to truly create a society that is lawful and ordered, then we have to also focus on those individuals who have the closest contact with our community members, and those are often police officers. And again, we can't train our way out of this issue, but I do agree that implicit bias training is essential, and not just the training itself, but tying that training to some kind of standard, right, and some sort of actionable step. So if you're required to take a one-time training and there's no follow-up, no booster shot, so to speak, no way to tie that to your performance evaluation as a police officer, there's less likelihood that people are going to adhere to that, training over time. There will be mission drift. That's right. Just human nature. So I think we need that, but we also need an open dialogue so that police officers also recognize their own innate, capacity to respond in the moment. And we're telling, young men of color to, not wear a hoodie or to be more respectable, but perhaps that should go both ways, right? That there needs to be some recognition of how are you emotionally agitated in the moment as a police officer? Are you aware of your trigger points? Are you able to de-escalate yourself in that moment in a way that could produce a more peaceful interaction?
Maybe we could have more basketball tournaments between people in the community versus the police officers, and maybe that will form some kind of bond and different kind of relationship between them.
I would love to think, excuse me, that basketball tournament would solve all things. I love basketball. Right. Go Huskies. But I also think that we need more opportunities for police officers to be in community with the folks, not just showing up to police the community, but going to community events, right? Doing the kinds of community policing that we observed, like in the 60s and 70s.
To show that there's support for the community, not just there to police them, but
that's right. And a general empathy.
Right.
For those that you are protecting and serving. And I do think that exists among a lot of law enforcement officers, but I think that there are far too many others who don't have that empathy, and for that reason, police in a way that leads to more complicated and destructive outcomes.
So do you have any final words to say to our viewers? These are a lot of young men, but also older men. They're partners, because we also reach out to the women in their lives about mental health issues, about the stigma, and talking to someone and finding at least that one person that they can reach out to about any problems they may be having.
I think it's really important for women who have close connections with men and boys to recognize the differences in the capacity to emote that men may experience, and that we are all open to listening, hearing, the distress that men and boys face, but more importantly, that we approach this with a sense of love and compassion. I think, again, as I talked about earlier, there's a huge empathy gap in our nation for boys and men. They're often problematized and pathologized, and especially now in this era where, unfortunately, we're talking about really ugly matters like sexual assault and sexual violence. But I think in the midst of that, we have to push through the noise and recognize that boys and men need to be experienced as fully human. And they need to be, to be seen and visibilized. I think far too many of our boys and men feel invisible, and that invisibility has consequences for women and girls too. Right. So we're all in this together.
Great. Yeah. That's right. Well, thank you so much for spending the day with us and for giving us some of your words of wisdom. We appreciate it.
Thank you. Thank you.